I'm Laura Anderson and I'm a clinical neuropsychologist, and I do a lot of clinical work in the criminal justice system. But here at the Department of Forensic Medicine, I'm a PhD candidate, and my PhD is supervised by Dr. Jennifer Pilgrim, who's a toxicologist. And I'm looking at the psychology and the biopsychosocial factors that influence drug use and violence and harm that can arise from drug use. So there's lots of different facets of drug use in Australia. So for part of my PhD, I wanted to look at the different kinds of drug use in different contexts and to understand how different psychosocial factors like mood and mental health and environmental factors can influence drug use and how they might contribute to the different kinds of harm that can arise. So I've picked 3 separate different areas. So one of them I'm looking at is prescription mood medication use and harms that can arise from misuse of that. And another one is looking at drug and alcohol use in social settings and how it can provide as a risk factor to sexual assault and harms in that sort of way. And then another one that I'm looking at is drug and alcohol fueled violence and looking at some of the psychosocial factors that can contribute to that occurring in our everyday lives. So one of the reasons why I chose to do a PhD at the Department of Forensic Medicine here at Monash is because in my clinical work as a psychologist, I do a lot of work within the criminal justice system, and I essentially do what I'm doing in my PhD, and I assess people to try to understand factors that have contributed to offending or what has contributed to them being a victim, and I go off to court and give evidence and talk to lawyers and other sort of justice groups and things like that. So I thought that doing a PhD would give me that extra leg up and that extra base of knowledge and understanding to be able to contribute to both my clinical work and then also in the future to be able to do more research on this area. So I was really drawn to the Department of Forensic Medicine because it's got such a wealth of resources. It's linked here to the Institute of Forensic Medicine and lots of other great areas that we can tap into in terms of accessing great data sources and other sort of areas of expertise. So I'm working with toxicologists here and pathologists and all kinds of things I wouldn't be able to normally do as a psychologist. It gives me that extra ability to do research that no one else has been able to do. So both clinically and research-wise, it's really giving me that extra leg up in doing something novel and developing a knowledge and an understanding in an area that lots of other people around me in this setting wouldn't have. So in one of my research projects looking at drug-facilitated sexual assault and drink spiking, what I found is that in everyday society, there's a really big perception that drink spiking is a big risk and a big issue in that unsuspecting victims are out having a great time and a big sort of predator is coming along and doing nasty things and taking advantage of them in that sort of a way. But what's actually come out is that it's a lot more common that rather than it being an unknown predator, it's actually sort of within a social circle and it's people that we know, and it might be someone that's accidentally had a bit too much to drink or they've consumed drugs of their own volition in a recreational setting and perhaps become too intoxicated, and then it's someone that is within their social circle or within that setting that perhaps has taken advantage of that situation. But it's very different to what the social perception of drink spiking actually is. So I'm hoping that this research can really work towards educating young people about drug and alcohol use and the genuine risks and harm that can arise from that. So one of the great resources that we have available to us through the Department of Forensic Medicine is that we can access lots of the amazing databases that are collected within the justice system and corrections and things like that. And one of them is the National Coronial Information System. I'm linking that data to wider public health records, once again to try to get an understanding of all the factors of who these people were, their mental health and their functioning and their behaviour prior to their death or the harm that's occurred to them, so that we can get a deeper understanding of factors that contribute to these issues. And so I hope that by being able to use all these great resources like the National Coronial Information System and the other databases that are available from an epidemiological and a public health perspective, we can gain a greater understanding on a broader level of what are risk factors and vulnerabilities, so that hopefully we can work in a preventative way to try and instigate programs and education and treatment earlier on in the piece so that all these harms won't come to these people in the future.